Hey everybody, welcome to today's training on the homeless definition for CoC, Continuum of Care, and ESG Emergency Solution Grants Project. My name is Melanie Mondello, and I work for the Technical Assistance Collaborative, and I appreciate the time you took to join this training today. We have a lot of material to cover. This is our agenda for the next 2 hours. I always like to start this training with a quick overview of the types of programs that you can have under these two funding streams. So that way you have some framing for the definitions and how they would apply to the different projects that your agency may have. We're going to go over the at-risk of homeless definition, which applies to ESG projects. We're going to go over the homeless definition, which applies to both types of projects. Then we're going to dive into everybody's favorite chronic homeless definition, including how HUD is defining a disability. So that'll be the first part of our training. We'll take a quick break, and then we will go into record keeping. How do you prove all the things that I'm going to tell you in the morning about that people are qualified for the projects that you're running so that you make it through any monitoring or audits easily. If we have time at the end of the day, I have some other eligibility information that I like to share. If we're not able to cover it verbally, it will be in the slides that you have, and just some references to transfers and different nuanced things within the programs that are sometimes hard to find in the HUD materials. So if we have time, we'll go over those explicitly. If not, they will definitely be in the materials that you receive after the training. Also wanted to level set a little. We have 2 hours today. So as I said, we'll go over the things that are listed on the left-hand side, the definitions, how to document, and examples of documentation so you can see how it actually implements in your charts. We aren't going to talk about the full criteria for everything that people need to meet to enter a CoC or ESG project. And we're not going to be talking about coordinated entry prioritization, which intersects with all of these things that we're going to talk about today. Those are really big topics, and we're going to touch on them. But everything you hear today isn't the be all end all of eligibility criteria for CoC and ESG projects. This is true for ESG projects, especially because in many states, including Rhode Island, your ESG federal funds also has state funding, so there'll be additional rules based on your state requirements. So today we're really narrowly focusing on the homeless definition, but we're going to give you some framing information about that, but it's not the full eligibility criteria checklist. Okay, this is going to be a really quick overview of the Continuum of Care Program components. Again, you will have this in materials after the training, but I just wanted to do some level setting in case we have some people that are newer to this topic. I'm going to be using some terms that's important you know what they mean. So under the CoC program, HUD has a category that they call permanent housing. Permanent housing for the CoC program includes both permanent supportive housing, PSH, so we typically refer to it, and rapid rehousing, which is RRH. For the CoC program, permanent housing, there isn't a designated length of stay in the unit. The program participant has to have the same lease rights that you or I would have. So they would have a lease with the landlord or a sublease with the agency that they're renting from. And those leases have to be renewable, just like our leases would be if we were private renters. The PSH model includes services, as does the rapid, but the PSH model, you have to serve people who have a documented disability. So for PSH, the CoC program provides the long-term housing assistance to pay for units. People have to have a disability, and they have to meet the homeless definition. For rapid rehousing, it is also considered permanent housing, but the CoC program would only provide up to 24 months of rental assistance and the supportive services for people to get what they need to be able to independently pay their rent and achieve housing stability. In rapid rehousing, the client remains in the unit and the program rental assistance will end. So they're both considered permanent housing. They're just different models about how long the financial assistance and the service support continues. CoC also has a transitional housing program. This is currently a restricted model, typically only in projects that are called THRH projects. CoC transitional housing is up to 24 months. Still have to have some type of an occupancy or lease document, but it really is a time limited program. The person in the program may stay in the unit depending on the model, but typically the model is the person would then move to their own unit after they're done their time in transitional. Transitional doesn't have to be a full 24 months. It can really meet the needs of the people that are coming through your system. This is the CoC Joint Transitional Rapid Program. So these are combining the two models that I just talked about into a single project. This typically is a youth serving model, but it's also allowed for other populations. So there's some nuances in here. If you haven't done one of these and you're interested, then my best advice is that you look in each year's application for notice funding availability, because HUD in that notice clarifies what they're going to allow for this project type of how to merge transitional housing, which is temporary housing, and rapid rehousing, which is considered permanent, and how people move in between the two. So you do have this model within your agency. It's important as we go through today to really think like, am I admitting people to transitional? Am I admitting people to rapid? What does that look like when people move in between them? So just again, some quick terminology that you're going to hear today. These are some general considerations that, again, you'll have to reference for the future about if you're going to design this type of project, what it means. And there's also, it's very rare, but in some cases, there are support service only grants allowed under the CoC program. And these would be grants that only pay for services such as a legal team or an outreach team, something like that. So we're not going to spend a lot of time on that because, again, it's very rare for those to be awarded, but it is an eligible project type that we should, at least acknowledge. This is really the chart that you want to have handy as you're thinking about the programs that you run and who qualifies for which program. You probably have many hats. People on the training today, you might run many different types of programs, shelters, transitional, rapid, PSH. This chart tells you, again, for the CoC program, which category of homeless that is allowed for each project type. You will see that there are 4 categories of homelessness. These we will go over in detail today. Literally homeless, all project types, right? That's the classic definition of shelter, streets, the kind of typical homelessness that people outside of our fields think about. We'll go over category 2, 3, and 4, which are also allowed, but it depends on the mix of the programs on whether they're actually going to be implemented for that project type and within your CoC. So I do have a note here because HUD sets federal national rules, and then each CoC takes those rules, looks at the needs that they have, and then they set local rules. So right now, for category 2, you can see we have a little asterisk. Category 2 is not implemented at this time for rapid rehousing CoC programs in Rhode Island. So it's something that is there in the NOFO, but your coordinated entry system and how you prioritize and how you agree to prioritize as a community doesn't, that's not a priority population right now, even though there is a lot of need. So I just wanted to highlight that because, again, we're going to be talking about these big global things today. And each year in the funding application, HUD can change the rules about what's allowed and not allowed. So I just wanted you to have all this information in case in 2 years something is different and this changes for your CoC. That was a quick overview of Continuum of Care Program. We're going to go over a quick overview of the Emergency Solution Grants program components. So emergency solution grants can fund street outreach and emergency shelter. So street outreach, many of you may be familiar with. This is where staff go out into the community to talk with people who are living on the streets and encampments, possibly campgrounds, abandoned buildings. And you're meeting people in the community to help understand their needs, help them understand what's available to them if they want to come into shelter, what type of housing they need, what type of support systems, and really providing them with that first touch to the system and building the relationship and the trust to provide resources and get people connected with care within facilities if that's what they would like to do. Emergency shelter, again, many of you are probably very familiar with. Emergency shelter is a temporary shelter for people experiencing homelessness. There's no leases or occupancy agreements in emergency shelter. The length of stay in emergency shelters is different, typically by each shelter. And this is again where your funders, because it's usually more than one funding source, there's usually a state or local discussion about how long emergency shelter stays are, capacity, annual applications, all of that. The ESG program also does rapid rehousing. It's very similar to the CoC program, but it does have some really important differences. Rapid rehousing under ESG can be tenant-based or project-based. A lot of ESG rapid rehousing is very short-term, but it can be up to 24 months. That's just not a model that all programs use. It also provides supportive services so that people can get stability, get services, so they're able to continue with the units they find after the program backs out financially. And if folks can mute, and I think Rosa, you're on that. ESG also has a homeless prevention allowable component where people who are not in a homeless situation that we will be talking about may be able to receive some light touch services to help them not enter the homeless situation. And there's income guidelines for that. There may be additional guidelines within your local funding source based on priorities and amount of funding available in any given year. So again, the table that you probably want to have handy if you want the quick glance. For ESG, you can see all the four component types I talked about, and then the four categories of homelessness that we showed for the CoC program. And then you can see this last column, at risk of homelessness. We'll briefly go over the at risk of homelessness definition, but it does only provide, is for the homeless prevention component, and many of you are not going to have that component. That's not something that you run in your community. But we still should be talking about it today a little bit. So, okay. So if folks could, I know we have a mixed group today from all different agencies and different projects types. So just to help me know how in depth to go, I would love to know if people could share in the chat. What is your experience with documenting homelessness for people coming into projects? Whether that's as an outreach worker, whether it's within your housing program, if you could just pop in the chat real quick what your experience is, so I know kind of who's with me today, and then we can kind of go from there. We'll give that just a few seconds, maybe 30 seconds for people to pop that in. Okay, just looking through the chat. Yes, the slides will definitely be shared. Familiar, not familiar at all. Starting to learn about it. Okay, so we have a really good mix of people. This is great. Some people really new to their job, less than 2 months. Welcome. Thank you for taking your time to come to talk with us today. Okay, great. Okay, thank you. That's really helpful. Let me go back to the slides. So the next slide. Okay, one of the questions in the chat was about questions, and we definitely are going to take questions, but what we're going to do is we're going to go through the homeless definitions as they're written, then we'll take a break, and then we'll talk about the documentation. So right before the break, we can do a few questions, but I'm probably going to get to a lot of your questions in the second half when we talk about the right now we're going to talk about the what, and then we're going to talk about the how to actually document this in the second half of the training. So let's dive into the at-risk for homelessness definition. So the ESG homeless prevention component only, this is who this applies to. The federal ESG program does allow you to serve at-risk people who are at risk of entering the homeless situation, a homeless situation. There are 3 criteria. So there's an income criteria of income below the annual median income for your area. HUD determines that each year. It's published publicly, really easy to get to. Does not have sufficient resources. So that would be based on your conversation with them about exploring natural resources, exploring people that they can live with within their social network, exploring financial resources. And then at risk of homelessness, also you have to meet one of the following conditions. So you have to show that you have the income, you don't have the resources to do this again, to get rehoused on your own. And you have to show one of these kind of instability factors about you're really right on the edge of entering homelessness. You're right on the edge of entering a shelter or having to live in an unsheltered situation. So how this is implemented again is locally defined. So we're going to talk about the global definitions, and each year your state will put out RFPs and create programs that implement this, and those programs will know their specific criteria to move forward with things. Category 2 for at risk of homelessness is a youth or child who does not qualify as homeless under the section before, but qualifies as homeless under any of these acts: the Runaway and Homeless Youth Act, which you know is RYE, Head Start, the VAWA Act, Public Service Act, Food Nutrition, Child Nutrition. Unfortunately, there are a lot of different definitions of homeless in our support system. So again, depending on how you implement the project locally, anyone who is considered homeless under these definitions could also be admitted to a homeless prevention program. It is not up to you to know these definitions. Your partners who are experts in this definition, they will know, and they will be your partners in helping to determine if someone meets that or not. So you don't have to be an expert in all of these. You would partner with the experts in RYE who can say, like, this is what that homeless definition is. Oops, sorry, hold on 1 second. No idea why it just went to the end. Close your eyes, we're gonna get dizzy, we're gonna go all the way back. A little preview of what's to come. Okay, sorry about that. Category 3 of the at-risk is a child or youth who does not qualify under this section, but for some reason the McKinney-Vento Act, which applies to education, was not in the previous list when they wrote the rules, so it's its own separate bullet. So this is really the definition that the Department of Education uses, and it just explicitly states that it would be the youth and the parent or guardian that's living with that. So it'd be the whole family that would be able to be entered into the program. Again, this is for a very small program component for homeless prevention, just for ESG. So not many of you on the call, but I thought it was really important just to note that that was there. Okay, this is the part that's going to be applying to most of you, and the part that we're really going to dig into a lot of details about how to document. The homeless definition for the CoC program and ESG program has 4 different categories: literally homeless, imminent risk of homeless, homeless under other federal statutes, and fleeing or attempting to flee domestic violence. We are going to talk in depth about 1, 2, and 4. Category 3 is in writing, but nobody, it's not implemented yet for the project. So it's there for the future if it ever gets implemented, but we are not going to spend time on it. And I do not want you to get excited about the criteria there because we are not allowed to use them yet. So it's there for your reference. It's not there for your use right now. Category 1 includes people that are living in unsheltered situations, like I talked about before, living on the streets, living in encampments, living in vestibules, like maybe they're sleeping in a bank, kind of like vestibule area after business hours. Any place that's not in, safe, it's not meant for people to live in, condemned buildings, that's not an emergency shelter. Obviously, emergency shelters are included under the literally homeless category. And within a limited scope, people leaving institutions are also part of the literally homeless category if, this is a big if, They were there for 90 days or less in the institution, and they were unsheltered or in emergency shelter right before they came in. And that's really important to know that nuance, because to admit someone who's coming from an institution, you're going to have a higher documentation burden, right? You need to prove that they're leaving an institution and that directly before they were in one of these living situations. So it's just really important to know that that's available to you, because some people hopefully get, help that they need. Maybe they're connected with a resource that brings them out of homelessness temporarily, but they really still have no place left to go back to. So people don't lose their literal homeless status as long as it's 90 days or less, and they were homeless right before them. Category 2, imminent risk. So this is part of the definition that talks to all the people that we know that are, people call it also precariously housed. This is households that are going to lose their residents within 14 days and don't have any subsequent residents identified, and also lack the resources and support networks needed to obtain permanent housing. This doesn't include people in institutions, so this doesn't include the exception like the category 1 does. So this is really people who are living in their own unit, they're doubled up with other people, they're in situations where they cannot stay. And the difference between people that are just moving between apartments and people that have nowhere to go are the resources, right? Like, just because you are out of your unit, you're staying with a friend and you're just waiting for your new unit to be ready, but you can afford it, you wouldn't qualify under this category. But if you've lost your unit, you're staying with your friend, you have a new residence identified, but you don't have the money to sustain it, do security deposit, whatever it is you need to do that, that could put you as eligible for this imminent risk. So it's really about looking at current living situation, don't have anywhere else left to go, and don't have the resources to be able to move into some other type of safe living situation um, going forward. Put a little note here at the bottom about kind of what that includes. It includes, like I said, places that you're renting that maybe you've been given a notice, you have to leave, you're sharing with other people. It also includes, or can include, hotels and motels that you're paying for with your own funds. If the family is paying for a hotel motel and they can't sustain that, they would be imminent risk. If a agency who's providing emergency assistance is paying for a hotel motel, that would kind of qualify under category 1. So if you have someone referred to you who's in a hotel motel, one of the key things to look at is who's paying for the hotel motel, to make sure that you have the correct documentation. Category 3, again, it's written in regulation, it's there, it is not active for Rhode Island. I don't think it's active for anybody across the country yet. So we're just gonna leave that as a reference and move right on to category 4. So for category 4, there have been some changes that we wanted to highlight today. Category 4, you'll hear as DV, domestic violence. It's formally titled fleeing or attempting to flee, I think is how it's in the regulation. And there's a lot of alphabet soup on here, so I'll decode this top. So category 4, fleeing or attempting to flee, DV VAWA 2022 update. So DV is domestic violence, VAWA is the Violence Against Women Act, and that was updated in 2022. And it made some really key changes to the definition to make sure that people were not being screened out who were living in unsafe situations. So I don't like to typically read slides to people, but I'm going to read this out loud because I think it's really important to hear it and then have it as a reference if you're serving people in this category, so that you can see kind of the breadth and depth of people that might qualify under category 4, who may be also qualified for your project. So the new definition as it's written with the VAWA update is people are experiencing trauma or lack of safety related to or fleeing or attempting to flee domestic violence, dating violence. So you'll see DV for dating violence and domestic violence, sexual assault, stalking, or other dangerous, traumatic, or life-threatening conditions related to violence against individuals or family member in the individual or family member's current housing situation, including where the health and safety of children are also jeopardized. This is also an and statement. And has nowhere else to go and lacks the resources to obtain the housing on their own. So the pieces that are bolded, those are the new pieces that were added that again expand, right, the written understanding of who would qualify under this category. I always like to give an example here because it's so wide ranging. So one of the examples that I like to share, and I can tell you whether it would be eligible or not, is if someone fled abuse a year ago and they're still homeless as a result of fleeing that abuse, they would be eligible under category 4 still. So they fled, they haven't been able to secure additional housing. The timeline of the fleeing isn't necessarily the factor that you're looking at. It's that they were fleeing and they're still homeless because of it. They never were able to get housing. Things haven't stabilized for them. A situation that would not qualify under category 4 is I fled the abuse a year ago. I got housed for 3 months. Then I lost my job and now I'm homeless again. That is not a category 4 because you're homeless. The family you're working with is homeless again because of an income loss, not because of the fleeing. So they are definitely a survivor of domestic violence, but that wouldn't qualify them under category 4 because that's not what caused their homelessness today. So I just think that's really important nuance to understand because unfortunately there's a lot of people living in dangerous, traumatic, life-threatening conditions. It's also important to qualify that for the sexual assault and stalking, this doesn't necessarily have to be the partner to the person. This happens from landlords, neighbors, strangers. There's a lot of power dynamics there for men and women around sexual assault and stalking. So it doesn't necessarily have to be the partner. It has to be that they are in danger. Okay. So again, we'll go on more on how to document that, but I just wanted to highlight that expanded definition of category 4. Okay. So we are going to go now into the chronic homeless definition, which applies only to people entering permanent supportive housing. But everybody else who doesn't do permanent supportive housing, please stay with us because just because you're not the one admitting someone to a permanent supportive housing, most of you are likely a referral source for permanent supportive housing. Maybe you're the shelter worker who has to help, who hopefully can help the project get the documentation they need to help prove that someone is experiencing chronic homelessness. Maybe you're the mental health agency who can help with documenting the disability. So I think, what we're going to go over today, the PSH program has the responsibility to get the final documentation in order before they admit someone to a CoC PSH permanent supportive housing program. But as a community, you can hopefully help all of your projects find ways to be partners in that and gather as much documentation as you can as you're helping people so that people can quickly enter their permanent supportive housing living situation and not have to wait because you're looking for documentation of episodes that happened 8 months ago. So the final definition for chronically homeless is that it's a homeless individual with a disability who is living in a place not meant for human habitation, safe havens, or an emergency shelter, so that category 1, has been homeless continuously for at least 12 months, or there's an episodic definition, which is at least 4 separate occasions in the last 3 years, where the combined occasion total at least 12 months. So people who are chronically homeless are 12 months, either 12 months continuously homeless or 12 months of homelessness over the past 3 years where there are breaks in the homelessness. Everyone asks, how do you define a break? So a break is separated by at least 7 nights. And again, here we have this institution note. If you're in an institution for 90 days or fewer, that does not constitute a break, which is very helpful because people should be able to get the treatment they need. If they're in the hospital for those days, the month and a half that they're in the hospital still counts towards the 12 months. 90 days and up, it's a different situation. We can talk through, but that's the definition as it stands now. The second part of the definition is the 90 days, which I just referenced. And then the third part is also families. So you can see right on that first slide, it said individuals, but families can meet the definition of chronically homeless also, where someone in the household, typically the head of household, is able to be documented as having either those 12 months continuous. It's written this way because in I think the first iteration, they kind of forgot to add families because it was a demonstration project. So that is why families are noted in this third bullet. But don't be confused. Families definitely can still qualify for chronically homeless PSH units. At the end of this presentation, there's going to be a resource list that you'll have. You're going to be able to click on it from the handout. And I did some hyperlinks to some frequently asked questions that I think are still posted on the HUD Exchange that talk about this more in depth, that you can use to train up new staff, refer to after this conversation happens. So, okay, pop quiz. So I've been talking at you for a little bit now. I want to see kind of what you heard me say. So we're just gonna do either answers in the chat, or if you're shy, you can just kind of think about the answer and then I'll tell you. But the first question I had for folks is, do people have to be homeless for 12 months or do they have to be homeless for 365 days? So what do people think for chronically homeless admission? Is it 12 months or 365 days? Yeah, 12 months, 12 months. Some of the newer folks are probably asking, like, why is she asking this? She just said what it was. Um, yeah, sounds like the same thing, right? 12 months and 365 days. I saw that in the chat. So the reason I say it this way is because it used to be that you really did have to document every minute of every day, right? Like you had to show like Melanie was homeless all these 365 days. But we'll talk about under documentation, HUD wants to show 12 months of homelessness. So you only have to document 1 day within a month to then count that as a month that someone was homeless, unless you have evidence to the contrary, unless you know that they were not homeless the entire month. But they wanted to kind of remove some of that paperwork burden. So it could be 365 days, but if there's one, it's 12 months that you have to document, but you don't have to have in your file like 365 days noted out day by day by day. Okay, so it's a single day within a month. If I go stay with my sister for one night, she offered me a couch, I'm not going to break my homeless history and unqualified for myself. So it is 12 months that you have to be documenting. Let's see, institutions never count as a month of homelessness. True or false? This is false because again, if you're there for less than 90 days, you're not going to, sorry, the question was institution stays never count as a month of homelessness. And the answer is false. So if you're in an institution for less than 90 days, that month that you're in the institution still counts towards your 12-month count because you were in a qualified situation before and you're exiting, most likely, unfortunately, to a qualified situation when you're leaving. So that is just a quick review of those just some of the things that we said. Well, again, we'll go over in much more detail how to document those. So real quickly, again, this applies to the CoC program PSH projects. But if you're a rapid rehousing program provider who's on the call today, you may be referring to a PSH project. Maybe someone rapid needs longer term support financially and service wise than you realize. So this is important for you to understand the disability definition as well as the PSH providers. So that, again, you can help people collect the information as quickly as possible to be able to enter programs that they're qualified for and start that housing search as quickly as possible. So HUD defines the definition of disability for CoC program as having a physical, mental, or emotional impairment, having a developmental disability, or having HIV or AIDS. A frequent thing that I see is people trying to recertify disability at the annual, and you don't need to do that for the CoC program. At the annual review that you do for income and data gathering, you have to have a conversation with the person, and maybe once you build a relationship with them, they gave you information they have actually multiple disabilities. So maybe you're in your data system capturing multiple disabilities, but for qualification to be part of the project, it's only at entry. You don't need to ask someone at the year mark if they still have a long-term continued, disability, because they likely do. So the categories here, to go into a little more detail, are physical, mental, emotional impairment. So this could be caused by alcohol and drugs, post-traumatic stress, brain injury, and it's a 3-part definition. So 1, you have it, right? Physical, mental, emotional impairment. And it's expected to be long and continued or indefinite duration. And that is something a medical professional who works in the field of disability and symptoms that you're experiencing would know and be able to document. And it's impeding the person's ability to live independently. And the last one's easy, could be improved by suitable housing. But the first 2 are really something that the person and their medical team or counseling team would be able to talk about and certify. You can have mental illness and it's not impeding your ability to live independently. Sometimes it does, sometimes it doesn't. So there is the requirement to document these 3 things are in place in addition to the physical, mental, or emotional impairment. You do not have to get the category. You don't need to know someone's specific diagnosis. The medical provider who works, either it's a substance use counselor who might be documenting substance use disorder, or a psychiatrist or a licensed counselor who might be helping document a mental or emotional impairment. They don't have to say what the impairment is. They just have to document it's within this category. For the HIV/AIDS criteria, it's important to know that it includes both the disease, so having that disease, or any of the conditions arising from it. So there, and you can see here, there's not the and statements, so it's just that certification. It's not the 3-part test like the physical, emotional impairment. Developmental disability is a very long definition. It covers 2 slides. This is not something that you would be certifying at the project level. You have a state agency who I'm sure has the certification that the providers for this particular need category, they would be able to certify that for you. So they would be able to do this. And again, it's an and statement. It's everything on the first, then this, and additional needs. So I'm not going to, again, go big into that. It's more for your reference to know that it is a category that is allowable. We're going to briefly go into dedicated plus. This is a term that HUD created, I don't know, I think a little over 5 years ago, to try and give projects that do permanent supportive housing a little bit more flexibility. Because in smaller states or more rural communities, people aren't continuously homeless for 12 months. They aren't continuously homeless, even episodically, for 12 months over 3 years. It just looks different in different parts of your CoC and different parts of the country. So HUD created this dedicated plus definition, which some of your projects have adopted, to just make your PSH units more accessible. If in your community, maybe you've solved chronic homelessness in some areas, or you're close to serving everyone who meets the chronic homeless definition. So the dedicated plus definition as it's written now, and this is written in each year's annual funding application notice, is of course people that experience chronic homelessness can go into what HUD calls a dedicated plus unit. But then it also provides other paths. So it provides a path for people who are in a transitional housing project that maybe your CoC defunded because they allocated those funds to a different type of project. So if someone's in a transitional housing project, but they were chronic when they went in, they just needed a higher level of housing support to like move through to independent housing. As long as you can prove they were chronic when they went into transitional housing, and that project is being eliminated, then they may qualify for one of your PSH beds. The third bullet is people who are residing in that category 1, literally homeless, not meant for human habitation, emergency shelters, or safe haven, doesn't meet the chronically homeless definition today, but was in permanent housing within the past year, but they weren't able to maintain that placement. So kind of creating a little bit of a safety net for people who maybe got a voucher, found a unit, were not able to sustain that. Now they're right back in your system. So providing a path to permanent supportive housing care. It's important to say as I go through these different options, these are the things that HUD allows. At your local level, you have probably a lot more need than you have housing units. So within your CoC, your coordinated entry provides referrals to all of your projects. And your CoC has decided on a prioritization way to fill any beds that are vacant. So all of these are allowable, but what actually happens within your community is based on your written standards for how you're going to prioritize and then refer people to open units. The other path that HUD created were people that were living in the transitional housing portion of those joint THRH that we talked about. Again, if they were chronic homeless before, and this is where all you PSH, all the people that aren't PSH providers on the call, you can help by gathering this documentation when you're intaking people into your project. So that way, when you're exiting them, you have the documentation ready that you need to pass on to the PSH if they're going to a bed. The second bullet here is talking about people who've lived in a literal homeless place, but they didn't meet that 12-month mark, right? Or they didn't have 4 separate occasions. Maybe they had 2 occasions. They still were homeless for 12 months, but they didn't have enough breaks. HUD realized, oh, like we shouldn't penalize people for not getting a break from homelessness. So, and then Department of Veteran Affairs. So any VA program that meet the above criteria, they are also would be eligible for a dedicated plus unit. So that was a quick overview of the actual definitions. We're going to dive into next the actual way to like document these and what HUD expects to see in your files and what responsibility you have as the project, and then what you as referral partners can help your projects get going in. So I propose we do a few questions, Rosa, if there are any, and then we do maybe a 10-minute break and come back right before 11 o'clock. I'm going to scoot back to the main window. Were there any questions that people had about just the definitions that people want to ask in the chat or come off of mute and ask now? I don't hear any. I see. So go ahead.
There was a question earlier, says is chronic homelessness a requirement for PSH as well?
So chronic homelessness is a requirement for most PSH units. You would know whether it is a requirement for your PSH project based on your application to HUD. But I believe in Rhode Island, all the permits for housing units that are funded by the CoC now are either dedicated plus or fully dedicated to people experiencing chronic homelessness. Any other questions? What documents are required? Great question. That's what the second half of this training is going to go over. We're going to go over that in depth with examples. Let's take a quick 10-minute break because this is a important topic, but not the most exciting. I will acknowledge. But we are going to talk about the documentation requirements. So let's come back. It's now 10:50. Let's come back at 11 o'clock. I'm going to start right at 11 o'clock. We're going to jump in. So if you're walking away, take a stretch, grab a drink of water. We'll see you back here at 11 o'clock. Okay, everyone. I hope everybody is back. We are now going to talk about the record keeping portion of the homeless definition or of the homeless standards. Overall, if you're running a Continuum of Care ESG program, you have a lot of documentation requirements. Your organization has to have records about your application, what you promised you would do, your policies around finances and security. Your project has a file about how you're spending money, what your staffing is, and then you have your participant files. We are going to be talking today about the participant files and specifically the documenting homelessness within those files. So the requirements for you as a recipient is someone who has a direct contract with HUD. A subrecipient is someone who has a contract with someone who has a contract or a block grant from HUD. So you have to have written policies and procedures on how you're going to do this. Everyone coming into a CoC program or ESG project has to prove some type of homelessness for the definitions we talked about during the first half of this training. So you have to have policies about who's going to do that, what eligibility you need, and where that's going to live. What is the specific way that you're going to prove that in writing? And if you can't get the information from a third party, so like a shelter directly, because for whatever reason they're not responding, what are you going to do to document your due diligence to try and get information from the source that's closest to the person who is experiencing the homelessness? You have to have those standards in place. But as we talked about a little earlier, your referrals all come from coordinated entry. So you will have standards on how you're going to document homelessness, but it's for the people that your coordinated entry system refer to you to fill your open beds. You also can't have documentation standards that conflict with your CoC written standards. So if you're part of your CoC or if you want to go to their website, there's written standards. They may at some point say, this is how we're going to document category 4. This is how we're going to document category 1. So it's just important that you know, like you do have to have your own policies at your project level, or maybe your funder gives you policy kind of guidelines and then you write that out. But you also, it doesn't mean you can have your own referrals or that you can come up with new rules that the CoC hasn't agreed to. In my many years of reviewing files for different projects, new projects that have been existing, I think I finally figured out one of the problems that people have with homeless documentation, and that is that you're thinking about it the entire time you're getting to meet somebody. So homeless documentation and homeless status is talked about at referral. So when your coordinated entry sends me to you, they believe based on their records and what they've been told that the person would qualify for your project. But this is an understanding based on information that might be really new, or it might be a little old if the person's been in the system a while. So you talk about homeless documentation then you meet the person, you talk about it again, you talk about, hey, how are we going to document this? Let's get this in writing. That might take a day or two, maybe a couple weeks, hopefully not. And then you talk about it again at project start date. And what I'm finding when I'm reviewing files is at project start date, everyone's like, this is clearly odd. Why would we have gotten here if we're not, if the person's not homeless? but a lot of the information's in people's heads and it's not in paper. Or if it's on paper, it has a big assumption in it that I won't understand, which means your funder won't understand it when they come to review you in 3 to 5 years, about why you thought this person was eligible for this project under their homeless definition, right? Because the term homelessness means something different to everybody. It's more about where was the person living and does it meet this definition of homeless for your project that's allowable. So your documentation referral, great. Intake documentation, great. The only one that counts is that project start date. So whatever will support your project start date, showing that the person was homeless prior to that project start date, typically within 14 to 30 days, you kind of, the tighter, the timeline, the better, especially if, something has really changed for them. But ensuring that the documentation really supports the project start date in case that was not as close to your referral or not close to your original documentation as you hoped. Especially as you're serving people that are coming in to PSH as chronically homeless. And you have that 3-year look back, because a lot of people in more rural areas of your state are going to be episodically homeless. So you might start the process and then a couple months goes by for whatever reason that you haven't admitted them to your project. And then the 3-year look back changes. So you just have to constantly check that before you admit the person, before you start spending money. It's really important that you're doing that count about what's going on. But I think because you're talking about it so much, the final documentation in your chart can get really confused. So it's totally okay to have all those notes from pre-project start date, but at the end of this, you really need to bundle it down to, this is my homeless documentation that I would send to my funder. If they said, send me your file, I want to make sure that you're serving eligible people. HUD does define some general documentation standards. And this was really helpful when they did this a little while ago, because again, documenting things, it can mean what you want it to mean, but HUD has finally just determined what they mean by documentation standards. They want to see in your documentation of homelessness, who's telling you this information? Is it Melanie, who's the household head of household sister? Is it the shelter manager? Is it coordinated entry? Because the identity of the person can help you determine whether they're qualified and have the firsthand knowledge of the information to be able to verify that someone is in an eligible living situation. It's also really important that it identifies who they're talking about. Sounds basic, but I've seen a lot of charts where it says he is homeless. You think you're talking about the person that you admitted to the program. This is especially happens when you're doing email correspondence and you're, trying to keep confidentiality. So just making sure you look over your documentation to make sure your final homeless documentation that you're going to use to support that you served eligible people has the person's name. If the person uses a different name, so maybe it's William, but he goes by Bill, or maybe it's William and he goes by something that you wouldn't normally associate with that name, it's really important that you say that, because again, your funder's not going to know, oh, that's so and so. So just putting a little note to the side of, this is the name that this person goes by. So you can link it back to your official documents. And the third thing, which again sounds basic but is missing from a lot of files, is it provides enough detail regarding what you're trying to document, in this case homelessness, that anyone can tell. A lot of files will say Melanie Mondello is currently homeless. Great. That doesn't mean I qualify, because homelessness, again, is what you're experiencing. Currently homeless, living at the emergency shelter. Currently homeless, living in her car. You really need to have those details in that final document that you're calling your homeless documentation to be able to move forward. HUD did a really great training module, and I checked, it's still up on the HUD Exchange. It's called Recording and Documenting Homeless Status. It's very functional. You should have it as part of your onboarding. This is a screenshot from it. I also have the link at the end in the resource list that you'll have accessible to you. But this is an example of what HUD put in, like identify the staff. So here it says Mary Jones, Outreach Specialist, PATH Services. That is what it should say. If it just says Mary Jones, I don't know who Mary Jones is. You may know because you have a professional relationship, you all work together. It's really important that if you're using emails and even if it's on letterhead, that you are the person is identifying who they are, so we know which documentation standard to apply and where they work. Because again, you may know Mary is a PATH worker. I don't know that Mary's a PATH worker in 3 years when I'm looking at your file. So it's really important that you have people specify either their title or their agency, and that you really make it explicit that this would be like someone who's actually seen John live in the encampment. They are third-party verification who has direct knowledge of the situation. Here's an example of identifying the person. It says John Rogers. It says the full name of the person. It's really clear if I have a chart for John Rogers that this is who we're talking about. And then the details. So again, it doesn't say John is experiencing homelessness. It says that he's living in an encampment. This is where it is. And I've been providing services to him since this date. So you can kind of put together the puzzle about how long this person's been homeless based on this person's knowledge, exactly where they are. Encampment equals unsheltered, literally homeless category 1. You can really draw the line right across for you. So again, this example is in the slides, and it will also be in the HUD module, which I strongly suggest you put as on part of your onboarding, and maybe even just have people watch annually if you're having a lot of problems with documentation. HUD also has a preferred order of documentation that they hold you to. So they want third party if at all available. So third party means it's the person with direct knowledge of the situation. They will accept intake worker observations if third party is not available. So that would be an example would be you're meeting with someone to do an intake. They're telling you, that they're living in their vehicle. This is a thing. You walk out to the car with them, you can see all of their stuff is in a vehicle. It's taking the information that you have that you believe to be true, the visual that you had, or information from that person, and documenting that, because this person might not have any connection to other workers that have visited them where they're living, or if they're in a shelter, for whatever reason, the shelter is not able to respond to you, that type of thing. There also, you can accept certifications from the person who's seeking the housing or seeking the shelter from you, certification from them, if none of the others are available. So you can't go right to self-certification. You have to show in your documentation that you tried to get third party, intake worker wasn't available, and you can do some self-certification. The flag would be is if 90% of your charts are self-certified, HUD's gonna wonder, like, why don't you talk to any of your peers in the community? Why are you the only person that knows that this person is homeless? And they would probably ask your CoC to kind of work closer with you on that. So it's not that it's not allowed, and it's definitely allowed. It just should not be the majority of your charts. And if you do go there, the second bullet is what a lot of people miss, is the due diligence. Like I said, it's totally okay. Sometimes people are coming from another state. And so some of that homeless history is just not available to you within your systems. You just have to document that. You can say, tried to call shelter in, I don't know, Indiana, no response. Client reports they were there these months. And then you help them. You can write that up for people. They can sign it. But you have to document that due diligence somewhere. It has to be somewhere where you can find it later. A lot of people put their due diligence documentation sometimes in their case notes, which are even before like project entry. So when you enter the project, sometimes it doesn't come into the active, either electronic or physical paper file. So again, right before you admit someone, you just want to think, okay, is this story going to be really clear in 3 to 5 years when I get monitored? And maybe some of those case notes get copied and put with your documentation. Maybe you do a quick summary of your due diligence to support why you went to self-certification. Maybe you have a self-certification form that has a spot for the worker who's working with people to fill out and do it. There's no appropriate way to do it. You don't want to create more paperwork. You just need to know what your system, if I ask you for your due diligence documentation, that you can find that in a decent amount of time. I can't tell you exactly what you need to get because people's situations are so different, and the type of assistance that you're providing, whether it's under ESG or CoC and the project type, different people are going to come with different things. But for a lot of the situations, there could be available discharge paperwork if they were in an institution for less than 90 days. And that will help you document current living situation. Then you'd work with the homeless response system to get the pre-institution paperwork. HMIS, a lot of people don't use it to document homelessness, but it's really important. Let you use that resource. You spend a lot of time entering information into HMIS, which, if those of you are new on the phone, HMIS is the Homeless Management Information System that your CoC gathers. Homeless gathers information from all your homeless dedicated projects. So if the shelter that is referring to you is using HMIS, then you may be able to look there. You can see their admit date, you can see they're still there, and you can print that out or screenshot it and put it into your file. So those HMIS service transactions and program enrollments are really important. The one caveat is something that's an HMIS that was self-reported does not count as third party. So if you have a feature where I'm giving you verbally my history and I just type that in, that's still right, self-report, self-certification. It would be your program enrollments. It would be seeing contacts with your outreach workers, those types of things. There are some exceptions, of course, for shelter, street outreach, and victim service providers that I can go over as well. But basically, 90% of what you're going to do needs to follow this preferred order of documentation. So for documenting homelessness and street outreach, you are the first touch. Maybe someone else had been talking with folks before, but it's likely that this family or individual is talking to you for the first time. So for homeless outreach, you're not getting a referral per se. You might, but you're probably the one identifying people in, unsafe living situations. So the documentation could be, it's your note, right? Your outreach worker note of, today I was at this address, I met Melanie who blah, 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 is living in this situation. It could, again, maybe someone else did meet this family first and they give a referral and they're documenting, this is what I saw. Then they refer to your program for more follow-up. But also, right, if you're street outreach, self-certification by the family, that could be them verbally recording and you writing it down. Just somewhere in your notes, you should have that this person's living in X unsheltered situation. And don't just assume that, of course, everybody knows that, because people design outreach programs very differently across the country. Some people understand the rules, some people don't. So it's just important that you note somewhere where you're meeting people so that then that documentation can be used later to help them get into a housing program and not have to go back and recreate and come back to you to rewrite an official letter. They should be able to use some of those notes, possibly going forward. Emergency shelter, again, obviously you may be the first touch. You'll get a referral from coordinated entry that this is what the household is saying. Self-certification, discharge paperwork, could be a court ordered eviction if you're showing that people document this. Sometimes it's the shelter log, right? It's the information you're putting into HMIS. There's nothing special you have to do as an emergency shelter, but you have to have some way to show that you ask the question, the people are coming, they're staying at your shelter based on whatever criteria are set by your funding sources and your CoC. For category 4, for people fleeing dangerous situations, domestic violence, You really need to consider the safety of the family that you're serving and make sure that you helping them qualify is not going to put them in danger. So if you're a victim service provider, which is known as a VSP, self-certification from the family, writing down something that they're telling you orally and that they signed and date, that's all you need. If you're not a victim service provider, which means you're not sole focus on people fleeing domestic violence, self-certification is acceptable. Third-party documentation is also, of course, acceptable, but not if it jeopardizes the safety of the household. So it's really important that you're not saying things like, oh, like I need a note from the abuser that, you can't go back, or making people necessarily provide a police report that there was an incident. You have to be very careful about unintentionally putting people in harm's way. It's also important to know, we talked about this a little bit earlier, that situations for this category 4 do include if you are having to trade sex for your housing situation. That is something you're being taken advantage of, you're being exploited. If someone's being trafficked, if it's physical abuse, or if it's violence or perceived threat of violence because of the member's sexual orientation. All of these things count under category 4, even though it's still kind of formally titled domestic violence and fleeing domestic violence. So third party, which again, most funders would like to see because they want it from the person who's directly there. It has to be identifiable as coming from a third party source. So think letterhead, think email that shows the agency email address if that's obvious, or if the agencies have forms that have their stamp on it or their name on it. You just have to have some way for someone who's not you to know where you got this letter. It does need to be signed and dated. You saw the example of email. It could be something that's signed and dated by the staff that's referring to you. More often than not, you cannot read signatures. So add a print name line if people are just kind of doing scribble signatures, so that you can go back if you have any questions, or if we need more documentation. If I have a piece of paper that has a not legible signature, I don't know who to call. I have to call the agency. Maybe, there's no knowledge. Maybe there's been turnover. So it's really important to know like who is giving you this, and to either write in their name or have them write in their name, have that print name. If you have like a paper document that people are filling out, again, not jeopardizing people's health or safety. Okay, so this is where we were. So maybe these two, starting with domestic violence. Okay, very important. Thank you for flagging that, and apologies for the technical difficulties. So category 4, I was saying we went over this definition earlier, but the big thing about documenting for people in category 4 is making sure that you're not putting them in harm's way by helping them qualify for housing to get out of harm's way. If you're a victim service provider, which is a VSP, self-certification is acceptable from the family that's coming to you, or if someone's telling you something verbally, you can write that down, and then the household will sign and date that that's what they told you. If you're a non-victim service provider, self-certification or something from the VSP is acceptable. But again, you're not going to get third party if it's going to jeopardize. So you're not going to say you need a note from the person who's abusing you saying you can't come back. You don't need to provide full police reports showing all of the things that have happened to you. You are fleeing unless you're providing evidence to the contrary. Your self-certification is what would be used. And just to again highlight what we talked about earlier, it's called domestic violence, it's called fleeing, attempting to flee, but HUD has explicitly noted that this category includes people who are being trafficked, people who are trading sex for housing, people who are being physically abused, and people who are experiencing violence or perceived threat of violence because of a family member's sexual orientation. Third-party requirements, you have to know your third-party requirement. You have to show who it's coming from, So you can see the examples. Your letterhead of your agency is very clear. It would be like in my case, TAC, and I would write it on my letterhead and I would sign and date it. The email example that HUD showed, as long as email signatures show the agency and the name of the person. Sometimes there's a form that an agency uses. They have their stamp on it or their logo, but they do have to be signed and dated. They do have to be identifiable to someone who's not you, who's not like receiving the letter directly. But again, not if it jeopardizes the family. And I think what I was saying as things were really starting to glitch is please put a print name line or print the person's name if it's not legible. So if there is a question at a later date, they know who to go back to so that you can get any additional documentation that you've identified you need or that HUD identifies that they need to make sure that you're doing what they want you to do. So these are just some examples of third party. It could be a record of the stay in the shelter that's in HMIS or the comparable database. It could be the observation, like I said, from the outreach worker that describes where someone's living. It can be a written referral from another housing or service provider if they have direct knowledge. Maybe they're the shelter provider, maybe they're the one working with people in unsheltered. It could also be this top right corner on observation of a community member. So maybe the police referred this person to you because they have had to move someone on from business storefronts, or a business leader can certify that the person's been sleeping in front of their business. So you can be kind of creative here, but you just have to document where it is, and that they had kind of that firsthand knowledge of the situation. You can take third-party documentation orally. So you could maybe be talking with the shelter and say, like, Melanie talked to Rosa on this date who works at the shelter. She verified based on their logs that blah, 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 blah. So just making sure you document that out. That way people aren't remaining homeless because email's not working or fax is offline or all the ors that you all deal with every day. So that is okay. Again, you would just want to recreate those elements of like, who are you talking to? Where are they from? Why do they know this information firsthand? So again, I've talked through this, but just in writing, so you have it. The third party documentation, it has to be someone who has laid eyes on the situation. That is third party. If the person is not at the shelter, has not seen the person in their unsheltered situation, that is written observation. So that would be second order of priority, and something that's not, it's okay to use. You just have to say in your note why you couldn't get third party documentation and whatever that reason is. And here you have an example. Um, Met at encampment, if that's what the note says, or the letter that they've written based on their notes, that's third party. The drop-in centers, health clinics, food pantries, where people are self-reporting to providers, and there's other things kind of leaning that way. Those would all be second priority, and you would just have to say why you can't talk to the person who may have met them in that situation. So it's not that you can't, just the farther you get away from third party, the more documentation you have. Institutional stays, I feel like we've talked through. You can get the discharge paperwork, which says the date, and then homelessness documentation before. If the person isn't discharged yet, or doesn't have that paperwork because they're living in a homeless situation, then you can, call the person and do that written attestation that we talked about. If you're doing self-certification, none of the other stuff worked. Someone's new to the area, this is the first touch they've had of services within your system. People can self-certify, and it's really the same elements as before, just on a self-certification document, describing where they've been living, what the homeless situation specifically was, who the head of household is that's being talked about, who is hopefully the person qualifying for your project, and then signed and dated as true and complete. So you must document here again on this form or a form that is close to it, or something you can get easily, how you tried to do third-party documentation and due diligence.
And a lot of this self-certification is more, when I'm talking at this level of detail, is for the housing programs kind of beyond, beyond the emergency shelter. The emergency shelter documentation, as you saw, was an exception. So they're going to have logs. They're going to have different ways to do that certification so they can give you the documentation farther down the road. And then if you're a PSH project, it's really important to know there are caps for some of you on how many of your 12 months can be self-certified. So we'll talk more about that in a little bit for PSH programs, but there are caps on how many months can be self-certified depending on what you chose on your application. Due diligence, again, the thing that's missed the most in charts is that you probably have done the work of attempting to get third party, but you didn't write it down. So therefore you aren't going to get credit. Or if you're not doing third party because it doesn't feel safe, maybe it's a staff at the place they're living that they don't feel safe, so they don't want you to call, that you would document that. The person reported that to you, and that's why you're not going to call. I think I've talked through this quite a bit, but this is maybe a slide that you pull out for your reference about like what you want to see in the documentation. It's up to you as a project to decide if this lives on your homeless documentation form. If you have a separate page that is just like attempts to get homeless documentation, or if you keep it in your notes and you come up with a way to easily identify where those notes are and that they're going to be accessible, or doing a quick summary of those. So that is up to you how you do that. HUD doesn't dictate it. They just dictate that it has to happen. So before I get into chronic homelessness documentation, which is mostly for PSH, but I hope all the rest of you stay because you're partners in trying to help get this documentation for people. Are there any general questions just about the preferred order or how to document some of these things? I'm just going to go back to the preferred order. Rosa, is there anything in the chat that we should address or questions that people are typing right now?
There's 2 questions that came into the Q&A.
Okay.
And I think this person's going to have to just provide some additional context. Could you explain the second question again with the slide? This was about, I think, right when we went on break. And then the next question is, how do we handle requesting a replacement for residents for a CoC unit? It seems to take months before we are able to get a new resident sent to us that qualifies.
Okay, yeah, I see that. So Carrie, we're unfortunately not going through the coordinated entry procedures today, but that is a coordinated entry question and something that you can bring up with your coordinated entry staff and committees, or follow up with one of the CoC staff afterwards. So I don't have an answer to that question. And then could you explain the second question again? Maybe it was the second. If you want to, again, put in clarifying information, I can talk to that if there's more information provided about the second question. Maybe it's the second priority, the written observation. So I'm going to continue on, but please ask at the end or clarify in the chat. Okay, so chronic homeless documentation, it has 2 different parts: homeless status and disability status. We've talked about disability status already. There's more information available there if we need to get that to you. But we're really going to focus on this homeless status and the continuous homelessness for 12 months, or how to do episodic documentation for cumulative homelessness, which is 12 months over 4 occasions within 3 years, with a break being at least 7 nights. It is people in chronic homeless beds do need to be experiencing literal homelessness. So places not meant for human habitation, shelter, safe haven. Again, here emphasizing a single encounter in a month does meet the standard. It is sufficient unless there's evidence of a break. If you can see, oh, this person got housed, right? If you know that, that's different. But if there's no evidence that the person had a break in their homelessness, people go from shelters to streets to there's a lot of different ways. People are just doing what they can. So a single encounter with a shelter in a month, as long as you don't have information to the contrary, will document that whole month as homeless. The months to oh, sorry, I heard a question.
I'm gonna take mine. Thank you.
Oh, someone, can you go on mute?
Thank you. All right,
Antoinette, can you? Thank you. So 12 months continuous is exactly what it sounds like. How to do this? Maybe you look in your HMIS records, you can see your shelter entries, and you can see that it's been 12 months in a row that they've been there. If you're working with someone who maybe that shelter is not in HMIS right now for whatever reason, they could provide you something on their letterhead. Maybe the HMIS provides you with 8 months, but people were living unsheltered in between. You could see there's an outreach worker note. Maybe they could fill the gap for the months. Maybe they're out in an institution, which is why they're not showing anywhere. That could be something you could have the person certify or confirm with other providers. And then again, with 12 months continuous, maybe some of it's HMIS, some of it's outreach, some of it's self-certification. It's okay to have that mix as you're trying to get this documentation of an entire year of somebody's life. This is an example of what your continuous documentation could look like. In January, you might just have this little 1 day. April, you can see the whole month. You can see each of them can be different. It's just I see at least 1 day in each month, and I have the backup documentation from that third-party source, which could also be HMIS if they are participating. So this is just, a visual example about how each month can be very different for how many days within the month you might be documenting for folks. So for the 12 months cumulative or the episodic homelessness that people unfortunately are experiencing, still 12 months, but it's over the last 3 years. Here again, you have HMIS records. HMIS records are good for the actual stay in a homeless situation, but they're also good. They can sometimes show a break. This person went into transitional housing or got an apartment for a little while, right? Like sometimes that information and story is within HMIS, and you can get some of the documentation there. You can interview the applicants and say, okay, are there any times you've been housed for more than 7 days? Have you stayed with family for multiple months and then maybe it just didn't work out? The breaks can all be self-documentation. If they're not evident in the paperwork that you have available from your providers or your HMIS system. Outreach workers, again, may be able to tell you like, yes, I was working with the person, then they went here and then they've come back. Again, institution stays less than 90 days, you'll be able to count the whole month. More than 90 days, that would be a break. So there's a bunch of different ways that you can go after this. It is more cumbersome, and I apologize on Hunt's behalf for that, but it's really important that you're clear on documenting those full 12 months so that you don't have any eligibility issues with your PSH units. And if you are someone who's working with someone who's been in a long-term homeless situation, the more you can do to gather that documentation and have it ready when the person gets referred, the quicker they're going to be able to get into the housing unit. It is the responsibility of the receiving project to do this because they're the ones spending the federal funds. But as a system, anything you can do to support people being kind of what we call document ready, so they can move as quickly as possible through the intake and approval is good. I'm not going to read this to you, but this is just a visual example about what a cumulative episode could be. You can see I have at the bottom right-hand corner, the referred date was May 4th. By the time I got everything I needed, unfortunately, it was June 1st. So I'd be counting from June 1st backwards as you go through this. HUD has a sample form to help you document chronic homelessness. You can also create one. None of them are ideal, but the HUD form I think is really decent for helping you walk through, like, do I have 12 months and what do I have to back up that 12 months? But it's really important to know filling out that cover sheet that has like a summary of the 12 months is not third party. You have to have backup documents if you have a cover sheet that explains what the homeless situation is. And that would be whether you're doing chronic homelessness or not. You can't just write a cover sheet that says, I know this. You have to have backup documentation to it. If you have like kind of a summary sheet. It talked a lot about the HMIS database, the single day in a month. Self-report doesn't count if someone is verbally telling me as the caseworker and I'm typing that in. That doesn't count as third party. That would be self-certification that the person would sign with the program that's receiving them. It can also be the comparable database. Your DV or VSP providers have their own database outside of HMIS for safety reasons. So here's a question. I have this slide. This is from the HUD materials. If you were to look at this, how many months of homelessness would you say this is documenting? 1, 2, or 3? You can put that answer in the chat. Remember, it's just 1 day a month. It has to be from qualified, someone who has direct knowledge if you're doing your third party. What do folks think? I'm gonna open the chat real quick. So this to me would be 2 months because I see that they were working with a person in February. And this email is from March 1st. So that would be 1 day in February and 1 day in March. So this would be 2 months of homeless documentation for someone who's working on doing their chronic homeless documents. Documenting breaks, it can be third party if you have it, but it also can be 100% self-report. There are no caps here. So you just have to document what the breaks are. The HUD form has a space. If you have your own form, you would just have a space saying what the breaks were so that you can count those out. Let's see, I'm going to go real quickly with some examples of what a break is. So if someone's staying at a friend's house for 20 days, that would definitely be a break because it's over the 7-day mark. If someone got funds and they're going to stay at a hotel for 2 nights and it's the person who's experiencing homelessness who's paying for it, that is not considered a break. 2 nights in a hotel does not get rid of someone's homeless history. If someone's paying in a hotel and a local church is paying for it as emergency assistance, that is not a break. If someone's staying in a shelter for 7 days and then they go to their car and they go back to the shelter, those aren't considered breaks. They're just experiencing homelessness in different situations. Staying at a partner's house for 15 nights. This is where we kind of get into some gray area. If they were consecutive, if someone left homelessness and lived with someone for the 2 weeks, then it's definitely a break. If they weren't consecutive and people are popping in and out, it's probably not a break, but you would just kind of talk through with the person kind of what that looks like and how many days. And it could be a place where you're like doing the self-certification. Disability documentation. Again, this is homeless status training, but I can't help but give you the information you need. So I'm not going to go over this, but it's going to be in the slides for your reference. I always like to include this. This is specifically about CoC PSH, but it applies to all housing programs in that this is what HUD is seeing. It's like the #1 compliance issue. It's a homeless dedicated project. You have to document homelessness. So the example under compliance of the homeless documentation's missing dates. There's no signatures. It just says that Melanie is experiencing homelessness. It doesn't say the place, so I can't tell if HUD will think it's homeless. That part applies to everyone. The rest of it applies more to just CoC PSH projects that are doing chronic homelessness. So this is just a recap as you're, again, training staff, refreshing yourself. Chronic homelessness, 2 parts, disability and homeless, continuous or episodic, episodic 4 occasions within 3 years. A break is 7 nights. Fewer than 90 days in an institution is not a break. So if you just need one sheet, one slide to print, this is the slide that can get you the overview of chronic homelessness. So we're to the part where we can go through some nuances, but we're also 15 minutes from the close of the session. So before I go into some of these nuances that, again, you'll have in the slides, you don't need me to read to you. I'm going to stop share for just a second. And I would love to see if people have questions or concerns, things they want to talk through around how to document homelessness for your project type going forward. So people can pop questions in the Q&A, or they can come off mute. Rosa, I'm not seeing anything in the Q&A. Do you see any raised hands or anything like that? We should unmute somebody.
Right, do not, the person that had asked the question earlier provided more context.
They did?
Yeah. Well, a second question includes staying in an institute within 30 days.
For less than for 30 days?
Within 30 days.
Within 30 days. So, as long as the stay in the institution is less than 90 days, it can be within 30 days of admission if that's what the person's asking. So if someone was living in a qualified situation, got a referral to a housing project, was in the institution when that referral came up, then they would still qualify. But if everything doesn't happen before the 89th day, then you have a problem, right? Because we're changing their homeless status on that 90th day. So if the person is asking, can I take someone right from an institution if we have everything else? The answer is typically yes, but you want to be very clear in your documentation. The other thing I would suggest for folks is it always seems crystal clear because you were in the weeds with people that people are qualified and they're in these tough situations. You want to move as fast as you can. It's always a good idea to have someone else look at the file who doesn't know the situation to say, do you think this person qualifies? Or if you have copious notes, having some of them move to intake and just have a final note about the homeless documentation, that will be as part of your file or flagging that. So again, in 3 to 5 years, you'll know which of the 20 pieces of paper in your intake packet is your actual homeless documentation. So having that double check within your project is very helpful because you're typically so close to the situation, you might be making assumptions that aren't clear to an external reviewer many months later. Other questions or concerns? I see a question, are medical records for disability, would that count? Real quickly on the disability documentation, medical records don't usually have the 3-part test. So typically for disability documentation for PSH, it is the provider signing off on a form that says disability exists, not the category, continued, and housing would be improved. So that 3-part test is rarely in a medical record. So I would not suggest doing medical records for disability because someone can have a mental illness and it's not impacting their housing or their ability to have housing stability. So my general answer would be no on medical records for disability because it's too much information and it doesn't say the HUD definition. I'm not seeing any other questions. I can go over those other eligibility concerns that I know are showing up in your CoC also, if that would be helpful. Does that sound good, Rosa? Great, let me share my screen again. Windows. Okay. Okay, let's go through some nuances. Let me move these cameras over. So we talked a little bit about dedicated plus and dedicated beds. But what I wanted to highlight here for you, if you're a PSH program, depending on the types of beds you have, depending on what you put in your project application, a bed that is dedicated to serve someone who is chronically homeless, you do have to have a project level tracking system that you're showing that you're not exceeding the caps on the amount of self-certification, self-documentation that people are doing for the number of months they're homeless. If you're a dedicated plus project, but you didn't dedicate your beds and it's a specific question on your project application, the caps that I'm talking about, they don't apply. So dedicated plus without dedicated beds, which is a very technical thing to do, the caps don't apply. So if you're in a more rural area, like you just have a little bit more flexibility to be able to quickly document people and get them into your project because you don't have the caps that a dedicated project bed does. So I can explain more about that, or Rosa and I can take questions after the training because again, it's technical, but I just wanted to highlight that Dedicated Plus was partially created to help mitigate the really high burden of the record keeping for a strictly chronic homeless dedicated bed. These are the caps. Again, self-certification is always preferred. If you're dedicated, everyone can do 3 months. 25% of the households can certify more than 3 months. Sometimes you need more flexibility for more than 25% of your household. So that's where that nuance about dedicated or not dedicated beds come up. And I'm happy to talk to anyone about that outside of this training. There is some documentation on it. These FAQs, I will provide the links to it because people, when you say Melanie said, that doesn't count, right? You need to know that HUD said these things. So that is available online. And I also have the excerpts here in case it is not online at some point. I wanted to highlight that rapid rehousing can be used, and I believe is used a lot in your CoC as a bridge to PSH in case people need more support than was originally identified. So rapid rehousing participants can go to a PSH program and they maintain that chronically homeless status, but it has to be documented. They're not going to be considered homeless on your point in time count or anything like that. But again, there's some FAQs that talk about rapid as a bridge to PSH and those timelines. Where I've seen people get caught here is the person's already exited rapid, so they're just a person renting an apartment before the PSH accepts them and moves them in. That doesn't count, so they have to still be enrolled in their rapid project and go directly to PSH from there. If they've exited the rapid before the PSH is entering them, then they have to be in a homeless situation there, right? Like you're showing a very large break that usually messes up their chronic homeless thing. So really working as partners about when one project is ending and when one project is starting is really important. You can also transfer from PSH to PSH. It's not a typical situation, but I know it has to happen sometime because of service needs or housing conflicts. People may transfer, but the project that's transferring should provide the eligibility documentation to the receiving project because you will be audited based on your admission to your project. HUD's not going to go back and audit the original project that transferred them. You need to have that eligibility documentation. So I've seen charts that say like, see blah, blah, blah's file. Well, blah, blah, blah is not part of your project and HUD is not going to call them. And they may have already put the file away or destroyed the file because they were exited from their program and it was after 7 years. So if you're receiving PSH to PSH, even if it's inside your agency, you really need to bring that homeless documentation forward clearly and make sure that the story holds true. HUD doesn't talk about this a lot, but it does happen sometimes where the person who originally qualified for the household, the slot, the housing place leaves the household. So if that happens in a CoC program, the family can typically stay to the expiration of the lease, right? That could be a month, it could be 11 months if they just signed. And that's for death, incarceration, or institutionalized for more than 90 days if you need to stop the rent payments and it doesn't look like that member is coming back. The other option, again, it's a lot of documentation, but when I was running a rental assistance program, I did it at least a couple times a year. Only one person has to qualify coming in, but typically all the members of the household would have qualified. So you can work with the remaining adult member to say, hey, let's go back and see if we can show that you're qualified. And you would put that in the chart and transfer the housing assistance to them. HUD has accepted that, but you do need the documentation. Not all adult household members who are remaining came in with the original person, but a lot of times the people that are left in the household were experiencing homelessness just as long as the head of household person. So it's just a couple paths to try and help people a little bit when they experience the situation where the person that qualified for the assistance is leaving the household. So that's what I have to tell you today. Again, when you get the slides, these are some places to go for help if you want to clarify how you do this locally. This is a resource list for the HUD Exchange, specifically about documenting homelessness, and then just some more of their general pages. These are some trainings that the first one, recording and documenting homelessness, all of your staff who are doing intake work or documenting work should definitely go through this training, have that part of your onboarding. If you're doing chronically homelessness, there's a frequently asked questions webinar that's linked here. There's the link to the FY18 dedicated plus. It is inactive today, but I'm hopeful that HUD will put it back at some point. If you're chronic homeless, here's some more resources there. And then that is what I have for you today. So this is how to get in touch with TAC. And we will be sending out a survey after the training to get feedback. But I'd love to take the last 2 minutes. I'm gonna go back to the main window. Rosa, any questions come in? Did I scare people away from this document, from this topic? It's so important. And it really is something that is so simple, but it's really, people get it wrong all the time. So I'd love to answer any questions that people have. Well, as you get back to your programs and you start putting this into practice, you may have questions. So the resources will be there. You will have the slides. And please reach out if you have any questions, and we'll try and get you connected with the resources you need to be able to have a compliant program and pay no money back to any of your funders because you got it just right in the beginning. So thank you for sticking in there for 2 hours, for talking about the homeless definition. And thank you for all the work that you do. And I hope you have a good rest of your day.